Daystar Kids is a community-based pediatric complex care center serving children with medical complexity ages 4 months to 5 years. 88% of the children enrolled have a gastrostomy tube, also called a G-tube. In collaboration with Golisano Children's Hospital, our interdisciplinary team sought to understand G-tube dislodgement in a community setting, both at Daystar Kids and in the child's home. We tracked dislodgement that occurred on-site at Daystar to better understand frequency, surrounding circumstances, and documentation. We also surveyed families to inquire about their experiences managing dislodgements at home and their level of confidence and anxiety in addressing unplanned events. The survey had a 90% response rate. Our project resulted in streamlined processes at Daystar Kids related to dislodgement tracking, documentation, staff education, and inventory management, as well as 2 family education events held in the spring with the agenda informed by the survey. 100% of the families who attended felt like the sessions were informative and were likely to attend another session in the future. We have 4 upcoming family education events related to feeding and nutrition, highlighting topics requested by the families. Thank you, GRQC, for allowing us to share our project.
We are thrilled to present the University of Rochester's Postoperative Opioid Stewardship Program, a comprehensive program that is the product of an extensive collaboration between the Department of Surgery, the Quality Institute, and the Recovery Center of Excellence, and has been supported by medical faculty and HRSA grants. This groundbreaking work involves a holistic approach to eliminating opioid overprescription through patient, family, and provider education, and innovative modifications to the medical record which allow us to match prescriptions to patient need. Surgical teams establish evidence-based prescription targets, and dashboards allow us to monitor for variations in prescribing behavior by any clinical or demographic factor you can imagine, so that we can investigate significant outliers and identify additional opportunities for improvement. Since the inception of this project, we have dramatically reduced variability in prescribing across our department and increased the proportion of opioid-free discharges from 39% to 58%. Simultaneously, we reduced the average discharge quantity from 9 to 3 pills, all while decreasing the number of patient calls for pain medications after discharge. This means that we have reduced the risk of opioid misuse among our patients, their families, and communities. We will continue to expand this work across UR Medicine surgical teams, including those at our affiliate hospitals and dentistry.
The community-based doula program is a partnership between FLIPS, Healthy Baby Network, Health Connect One, and Finger Lakes Community Health to address health inequities and improve the health and well-being of Black and Brown women, infants, and birthing families in our community. Doulas play a critical role in addressing the maternal health crisis. Healthy Baby Network and Finger Lakes Community Health are employing doulas and providing doula services at no cost to low-income Black birthing individuals in the Rochester area and to birthing individuals in the rural migrant farming community. A doula is a trained, non-clinical professional who provides physical, emotional, and informational support before, during, and after childbirth. They are trusted members of the community and help their clients to feel empowered to advocate for themselves. This program has served over 150 birthing individuals to date. Data is collected related to client engagement, the use of medical interventions, and labor, delivery, and postpartum key performance indicators. Overall, individuals receiving doula care have a positive birthing experience and better birth outcomes.
The setting of our project took place on a 24-bed acute medicine unit at Strong Memorial Hospital. The aim of our project focused on improving sepsis-related mortality through timely administration of antibiotics to patients meeting sepsis criteria within 1 hour of the diagnosis. We choose this project because sepsis is a life-threatening condition that affects 1.7 million Americans annually, with a mortality of 16% without shock and 56% with shock. CMS spends annually over $60 billion of taxpayers' money to treat this condition.
Project planning and implementation by our interdisciplinary team involved forming a protocol, utilizing PDSA model, and identifying opportunities in improving the workflow throughout the entire prescription process in order to reach our project goal. Discovery of key findings and results were identified and optimized by revising process and replacing challenges with solutions. This process improvement project did not require any additional funding, and with minimal education and intervention, it can be easily replicated in other patient care areas of the hospital.
I'm Dr. Brianna O'Connor, Chief Clinical Officer of Forward Leading IPA. FLIPA's innovative team approach centers on the Integrated Acute Contact Team, IACT. This approach brings together in-network behavioral health organizations and federally qualified health centers providing primary care that are serving the same patients. Care coordinators from both clinical teams work together to meet the patient's most acute needs, whether they're related to physical health, mental health, substance use, or social care needs. FLIPA's approach seeks to build a system for reliably ensuring that patients are getting their full needs met and are not falling through the cracks of a fragmented care and service approach. Our results demonstrate that this whole person integration is key to improving health outcomes and reducing unnecessary costs. This project has been a truly grassroots team approach to meet patient needs, and FLIPA couldn't have done it without our extremely dedicated member organizations.
My name is Ann Finch, and I am the lead advanced practice provider for the ICU at UR Thompson Hospital. Our team project was a hospital do-it group to create a hospital sleep guideline. Our goal was to dedicate a minimum of 4 hours of completely uninterrupted sleep to hospitalized patients. The overarching goal was to shift the culture in the hospital to prioritize patients' sleep by minimizing interruptions, clustering care, providing a quiet and peaceful environment at night, and mimicking the patient's home sleep patterns to the best of our ability. Over the course of 10 months, as a team of 10 members from multiple backgrounds, we were able to create a clinical guideline, an EMR order set, create and distribute promotional and educational materials throughout the hospital, and roll out an online training course to staff. We also created a patient survey and collected baseline data on patient sleep quality in the hospital. 6 months after the guideline was rolled out, we repeated the sleep surveys and were able to show a 10 to 33% improvement in patient sleep depth, latency, awakenings, return to sleep, and overall sleep quality.
Good evening. I'm Franklin Allen from Gorbel, where we improve people's lives. During the time of a global pandemic, Gorbel had risen to the challenge by demonstrating their commitment through this GRQC Team Excellence Award project. It began when we were tasked with manufacturing the DT product in the US without even setting eyes on the product itself. We relied on video resources from our Canadian partners and worked diligently to understand every intricate detail. Along with understanding the process, we had to find a new building to produce the product and hire dozens of team members. And we had to get all of that done within 6 months. On October 27, 2020, Gorbel manufactured its first DT machine built on a foundation of resilience, collaboration, and dedication. Our success is a testament of the true power of teamwork.
Hi, I'm Angela Sywalski, a Process Excellence Manager at Paychex. I'm excited to be here today to tell you about our communication mining email payroll effort. For this effort, we utilize process improvement and automation to solve for a resource constraint and to reduce handle time. Our processing team started with an email payroll push model that met resistance and did not produce anticipated volumes. We then implemented a manual pull process that was time-consuming and resource-consuming. We creatively solved for this resource constraint and automated the process by enabling a communications mining tool. This tool allows us to create and train keywords and phrases, scan incoming emails, and through our programming and use of bots, we reskill emails from the payroll specialist email queue directly to the processing center. Through this improvement, we've successfully utilized technology to move these emails quickly and accurately for processing, resulting in reduced handle time and cost to serve and increased employee morale. This effort has been so successful that we're continuing to expand to other operations areas.
Hi, I'm Brooke Randusky, an informaticist representing the U of R's team for Improving Lung Cancer Screening Utilization Quality Project. Our objective was to address a population health crisis by increasing lung cancer screening for eligible patients. This collaborative effort between imaging sciences and primary care drove a population health approach that achieved a notable increase in screening rates for lung cancer, the leading cancer killer for men and women. Lung cancers kill more people than breast, colon, and prostate cancers combined. Our goal was to double eligible patients screened. We achieved our goal of 40%. The national average is 10%. For every 550 patients screened, we save a life. Our success has allowed our program to save another 7 lives per year. This project exemplifies our team's dedication to pursuing excellence and living up to our motto, Meliora, Ever Better.
Southco has always had a clear vision to be the leading and trusted global source of engineered access control hardware, service, and solutions. I'm Fraser Pruitt, currently Quality Manager at Southco Honeoye Falls. To me, as a quality manager of a global manufacturer of touch points, latches, hinges, fasteners, and motion control devices, excellence means applying continuous improvement to 3 key areas: people, processes, and technology. While we pride ourselves on our international aerospace, automotive, and environmental standards, and how we benchmark internally against our global operations with a balanced scorecard, we still aim to glean insights and adopt best practices to elevate our standards even higher. By understanding and comparing our systems, we bring in outside perspective not just from the Baldrige type criteria, but from the exceptional experience of GRQC reviewers. At Southco, we're not just striving to create the best touchpoint products, but being our best organizationally. Together, we continue our journey of excellence, not just for our customers, but for our employees and our community as well.
Heritage Christian Services supports thousands of children and adults with intellectual and developmental disabilities. Our community habilitation program provides the opportunity for people to receive individualized support in their home and places in their community, identifying their own unique goals. To address a pattern of significant year-over-year financial loss in the program, a project team was tasked with identifying strategic opportunities to increase the financial viability of the program while also maintaining the quality of these meaningful services. As a result of the team's efforts, the program now demonstrates a positive bottom line, supports a higher percentage of people enrolled, and maintains participant satisfaction. Strategies for improvement included maximization of staff adherence to 15-minute billing standards, expansion of group activities, and dedicated efforts to increase billable service hours. In the future, we plan to match employees and those enrolled in the program by geographic location and are transitioning to a new, more efficient platform for service documentation.
Hi, my name is Jeremy Webster, and I'm a program manager in the Therapeutic Foster Care Program at Hillside. Hillside strives to provide the highest quality services for youth and families. In order to help ensure the service quality, Hillside uses an annual strategic plan with objectives and specific measures within those objectives. Progress on these measures is reported to programs on a quarterly basis through scorecards. Historically, these scorecards took approximately 12 weeks to produce. My team focused on improving the scorecard process to decrease this time to 7 weeks. Throughout the project, the team utilized several Lean Six Sigma tools, including value stream mapping, cause and effect analysis, and failure modes and effects analysis. The result of the project was a process that produced scorecards in 6 weeks. I would like to thank the GRQC for the opportunity to share this work.
The effects of the pandemic were severe on the local healthcare systems and created a public health crisis. The long-term care sector was experiencing severe labor shortages, and with insufficient Medicaid reimbursement streams, skilled nursing homes restricted access to their facilities. This resulted in an unprecedented number of patients waiting to be discharged from Strong, Highland, Rochester General, and Unity to nursing homes. These delays are devastating to patients and create overcrowding in the hospitals. The Transformational Community Care Coordination Program, funded by Monroe County ARPA funds, was developed in response to the crisis. The program addresses the barriers to discharge patients by providing block grant funds to nursing homes to secure the necessary resources to take care of patients who have complex needs. FLIPS led a cross-functional team that included stakeholders from the University of Rochester, Rochester Regional, skilled nursing facilities, and Common Ground Health. Through our collaborative efforts, the program has facilitated the placement of 533 patients since the program began in November of 2022.
Hillside is one of the most diverse child and family human service agencies in the Northeast United States. Our mission has evolved over 186 years to meet the needs of our community. Today, we offer community-based services, educational services, and residential services to meet a variety of needs for youth and family across New York State and Prince George's County, Maryland. With around 1,800 staff members documenting the services provided to each and every individual or family, you can imagine the amount of sensitive information in our electronic medical record. As part of our commitment to providing the highest quality services, we closely monitor who has access to these client files, as well as why they are accessing them. As a result, we complete quarterly random audits of the staff access. Staff and supervisors attest and document why they access specific files in the last 6 months. In this day and age, nothing short of 100% compliance is acceptable to us. Since our initial pilot for this project in the spring of 2022, where we achieved 100% compliance, we have continued to maintain that level through our quarterly audits.
The Enterprise Program Office at Paychex leads all IT roadmap planning and project execution. In 2015, we converted from waterfall to agile software development, which has been a key to our success. Through this transformation, we have continuously inspected and enhanced our processes. Our commitment to improvement has turned us into a very mature, agile organization, with our key areas of focus being quality and predictability. On an annual basis, we create a holistic roadmap that prioritizes and plans development across 20 programs and 200 agile teams. We manage 250 projects per year, with 60% of them spanning multiple agile teams. Through our commitment to collaboration and ensuring teams adhere to enterprise standards, we deliver 95% of our projects on time and on budget.
Hi, we are from Rochester General Hospital's MRI department and are so grateful for this opportunity to share our project with you. RGH MRI order volumes were exceeding the current capacity for one MRI scanner, creating delays, impacting quality of care, and extending the patient's length of stay in the hospital. Our goal is to perform 80% of the orders within 24 hours. In May of 2022, we were only completing 44% of the exams within 24 hours. Using lean techniques, we collaborated with staff from multiple disciplines to make several changes within our department, ranging from workflow to new software. Some areas of focus for this team were early morning start times, anesthesia workflow, automating the medication order process, and monitoring for order appropriateness. With these changes in place, throughput increased, and by November of 2022, we reached our goal of completing 80% of the MRIs within 24 hours.
Good evening. My name is Lane Denoto, and I'm a nurse practitioner and the clinical director of the Pediatric Tracheostomy Program at Golisano Children's Hospital. We care for children across Western New York and the Southern Tier who are tracheostomy dependent. The Pediatric Tracheostomy Action Plan project was identified as part of a greater need to address the lack of multidisciplinary care and reduce overall morbidity and mortality. This was a quality improvement initiative focused on reducing emergency department visits and encouraging communication between the child's medical team and caregivers. We aim to reduce overall length of hospital stay of children with tracheostomy tubes, hospital readmissions, and tracheostomy-related adverse events. We intended to see a secondary reduction in cost related to lengthy admissions. We aim to improve patient satisfaction with improved communication, access to care, outpatient support, as well as increased staff satisfaction. Success was measured by following emergency department visit data, hospital admission occurrences, and length of stay for this specific population. We also measured success with anecdotal feedback from patients and their caregivers, as well as medical team members. The Pediatric Tracheostomy Action Plan, as one of many projects, is aimed at supporting caregivers more to keep their children safe at home. Providing guidelines on how to triage illness at home may improve utilization of resources and prevent adverse outcomes. This is an ongoing project.
Hi, my name is Joan Beauchamp, and I'm the nurse manager of the Acute Stroke Unit at Rochester General Hospital. In the fall of 2022, it's obvious that healthcare professionals, including our own, were still grappling with the lingering effects of post-traumatic strain and stress from the COVID-19 pandemic. The acute stroke team at RGH worked together to develop a detailed program to help restore compassion for patients and their families, their colleagues, and for themselves. The project aimed to help our caregivers recover so that they in turn could provide better care and improve communication with our patients and their families. Thanks to teamwork and determination, the project was a success. One of the most substantial impacts of the project was that the registered nurse communication scores improved by 20% over just 6 months. This was incredibly significant because 10% of hospitals with similar scores were anticipated to improve their scores by just 6% by the end of 2023. The acute stroke team at Rochester General Hospital is committed to continuing this work for themselves and for our community.